It's now 1:15. I think we can start. Let's keep inviting people. Let's keep telling our colleagues that our second session has begun. So today I welcome you all to the second session of Policy and Advocacy. I'm sure that most of you also attended the one that was there yesterday, and I'm glad to say that there's a part 2 of what we had yesterday. So basically we are moving forward, we're adding on to what we had yesterday so that we become fully equipped. So before this session starts, kindly notify that you can hear me by sending an emoji or a reaction, maybe the first one or your favorite one, so that I'm aware that we can all hear this and we can start. So kindly send an emoji, maybe 3 people, so that we can start. Ngiyacabanga has sent. Yeah, okay, that's fine. I've seen more people sending. This is okay. So, without wasting much of our time, I want to acknowledge everyone present and okay, thank you very much, everyone. So I want to acknowledge everyone present in this session. You're all welcome. Feel free to mix and mingle throughout this interactive session. Let's make it interactive. Let's take part and let's enjoy ourselves as we learn. So today on the second session we're going to have a very great speaker. I've seen her biography. It's a bit long, so I'll try to make it short so that we still have time for the whole presentation. So this woman, let me just make it short. Yes. So our speaker today is Miss Dr. Wali Tiffany, who is a young pharmacist currently practicing in Kenya. So during her time in IPSF, she has served as the IPSF AfRO Regional Secretary and also has served as an IPSF Policy Committee member. So during her tenure as Secretary, she has led various policy initiatives within AfRO and also between other regional offices, so as to advocate for different global health topics such as non-communicable diseases. During her spare time, Tiffany loves to listen to good music, hang out with friends and family, and read widely. So I think we can stop from there. So without wasting much of our time, since we started late, I think I can hand over to you, Dr. Ali Tiffany. The floor is yours, and we can begin.
Thank you very much, Hazel. Allow me to share my screen shortly. Can you see my screen?
Yes, please. Okay, go ahead.
1 second. Kindly confirm that it is in screen share mode and presentation mode?
Yes, it's correct.
Okay, thank you very much. I am a new but old guest to IPSF, and it is such a joy to come back. I'm an alumni now. I don't hold such big titles in IPSF anymore, but I have interacted with your chairperson. I've interacted with your past chairperson. I have been in a lot of your shoes. In the 3 years I have been in IPSF, starting with participation in uh, webinars, competitions, moving on to being a contact person of my local association, that is KEFSA, and moving into joining subcommittees and finally being a part of RWG, all of which I'm immensely proud of because it allowed me to meet a wide array of people and engage in activities that not only ensured I grew as a person, but grew as a pharmacist. And, there's nothing as important as your network as you grow in your profession. So it is such a pleasure to see that IPSF is doing well now, just as it did back then. And seeing all of you here means that there's a huge potential for all of you, whether in the policy space, in leadership spaces, in research spaces, and all these other places, because IPSF is an organization that allows you to have all these tools at your disposal, free of charge, and basically driven by yourself. So your interests will ensure that your IPSF journey is the best it could possibly be. So I applaud you for being curious. I applaud you for volunteering yourself to learn a bit more about our organization and the things we do within IPSF that not only ensure that pharmacy students all around the world are able to become better and well-rounded pharmacists, but also grows you as an individual and ensures that in your own personal journey, as you deal with your patients in your respective countries, you're able to impart that little special skill that not everyone is able to have because of the things you're able to learn within IPSF. So diving into our topic for today, we're going to look at advocacy specifically. I am sure that this being day 2 of your policy and advocacy workshop, you have heard the words policy a lot, and it has, you've understood a little bit about what policy means. And maybe you've had advocacy in one way or the other, and you're not sure what advocacy is. But just to jog your memory, because I'm sure I'm not the only wide reader here or the only curious person. When you hear the word advocacy, what does it mean? Just a quick word, 2 words, 1 word in the chat box. And I'm sure Hazel can help me read the responses before we dive into a very short presentation. It won't take that long. What comes to mind when you hear the word advocacy? A verb, a noun. What do you think it is? Or what do you think it means? This being day 2 of the workshop and knowing that you all participated, yes. I just need like 2 responses and we're good to move.
Yeah, we have one that says to promote.
Any other response?
Not yet.
Okay. So I'm sure by the end of this presentation, you're going to at least understand 1 or 2 verbs or words about what advocacy is, so that you're able to explain it better to someone else when you're asked after the workshop that you so diligently attended, what advocacy, what policy is, and as you delve into this field more and more. So it will be probably a 20-30 minute presentation, but I'm sure after this, you're going to be able to understand a little bit about what advocacy is, what IPSF has done within advocacy, and then we can move from there. So the outline for our presentation today has 7 little components, as you can see on the screen. The first is the definition, what advocacy is, what it means, both broadly and in health specifically. The second is why advocate, why become an advocate in your own little ways. Why is it important? Third, we're going to look at policy advocacy within the organization. So what has IPSF done in this space, and where can you plug in, whether it is to enrich your knowledge or participate in drafting policy statements for the organization. How to conduct advocacy, that is very specific because IPSF brings together many minds from many different countries. And the beauty about advocacy is it is relevant in every community. So learning how to conduct advocacy will mean that in your own little ways, your own little spaces, you're also going to be able to advocate for the things you believe in. We're going to look at some case examples, so different policy statements that have been done within the IPSF. How to be involved. So how can you plug in whatever space you're in now? How can you grow as an advocate, a health advocate, as a pharmacist? And finally, what is effective advocacy within policy? So allow me to begin. So this is a slide showing a little bit about what advocacy is in general, not health advocacy specifically, but advocacy as a word. So advocacy, as you can see here, is a noun, and it just means to actively support an idea or a cause, especially by pleading or arguing for something. So it means standing in the gap for something you believe in on behalf of other people who may not be in a position to plead or argue for something. So you are an advocate. It's like a lawyer representing a victim within a court of law. You're believing in something and you are going ahead and telling people why it is important so that they can also plug into your idea or your belief system. Now, advocacy can be used in every field, every sphere that you can possibly imagine. Someone can advocate for something. From being a mentor to be able to share your experiences with other people so that they too can grow and learn from your experience. You can advocate for progress, you can advocate for funding, you can advocate for equity, you can advocate for resources, internship opportunities within your communities for small things that you know affect the people locally. You can affect for professionals, whether in quantity or quality. So increasing the quantity of the professionals within your country or the quality of the professionals being trained within your country. As a business person, you can advocate for more equipment, more space to be able to sell, more advertisement initiatives so that you're able to market your business widely. You can advocate for jobs around if you're in a space where you can be able to add other youths, other pharmacists, other people within your organization so that they too can get a job and they too can grow their own families. Advocacy doesn't have to be in health, as I said earlier. It can be in any space. If it's something you believe in and you're seeing it is not being addressed enough in the community or in the spaces you're in, then you can be an advocate. It means you can tell people more about it. You can explain why it is an important thing. You can explain why they can plug in, and you can explain why it is a necessity for the community to move in that general direction. Now, I have explained what advocacy is in general. But what does advocacy mean for health? Because all of us here are pharmacists in the making or pharmacists already. So I'm sure yesterday you learned about policy making, and it is that practice where you're putting it down on paper so that it is later on implemented. So you are drafting a theory, but now we want to see how we can move it into practice, which is what advocacy is. You move from a policy, an idea in your head, and you move forward into an action where you implement it so that it can then benefit the community you're representing. Now, in health, advocacy has this really long definition that you can see on your screen, but I'll try and break it down and simplify it so that you're able to understand what it means within the healthcare space. Now, advocacy means the promotion of social justice for health by influencing policies, systems, structures, practices, and attitudes, educating and mobilizing citizens and young health professionals throughout the world to improve health and equity at local, national, regional, and global levels. I know it is a mouthful, so we're going to try and break it down. One, advocacy is the promotion of social justice for health. Social means people, and justice means upholding something that people are being victimized about at the moment. So people are suffering because of a lack of something. In this case, it is health. So we're trying to promote justice for the people within the healthcare space so that they're able to become better at maybe receiving healthcare or getting services. How do we promote this social justice? We can see two ways in our definition. One, by influencing the health policies that are already drafted within the constitution or in acts of law within your country. The health system, because you are part of the health system, the structures of healthcare within your country, the practices and attitudes which affect us directly as healthcare workers and healthcare professionals. You are responsible for the healthcare practices and the healthcare attitudes because they will start with you. What attitude do you have as you promote your healthcare services that you're offering within a particular healthcare system? So it is in the hospital. The hospital is the structure. The system is the entire system, including the hospitals, the clinics, the pharmacies, the government. And then the practices and attitudes are what you can do as a person. So the first way we've said is influencing these policies, these systems, these structures, these practices and attitudes, starting with yourself. And then the second way of promotion is by educating and mobilizing the citizens of your country who have nothing to do with healthcare apart from being the absorbers of this service, and other young healthcare professionals, including yourself, throughout the world. So you educate and you influence. Those are the two parts of advocacy that are important to note. Why do we influence and why do we educate? It is in order to improve health and equity at local, national, regional, and global levels. Where you start from in your local spaces would then cascade upwards to national spaces, regional spaces, and global spaces. Every big initiative, whether it is innovation of something as big as Facebook or something as big as, I don't know, in my country, maybe I could look at Wangari Maathai, who won a Nobel Peace Prize just for planting trees and caring about the environment. It all starts with your own personal initiative. Advocacy has got to start at your level. And as you bring more people in, you onboard them onto your idea, it grows more and more and can reach global levels because that little idea you have would impact not just yourself and your family, but everyone around you, and can even reach global levels and result in you winning a Nobel Peace Prize. I'm sure it is a dream for all of us, maybe just me, but I digress. So we have broken this advocacy definition down, and I'm sure you've taken down notes because you're good students. So we'll move on to the next slide. Why should we advocate as youth? Why is it important to advocate? We see 4 points here. One, because we have diverse perspectives. This means that we don't think the same, we don't have the same backgrounds, we don't have the same know-how, our education is not the same, the way we think is not the same. Which means when I bring my small idea and you bring your small idea and someone else brings their small idea, together we're able to build something concrete, something that addresses more than just one angle of a problem, because in our different ways of thinking, we're able to approach a problem in a different way. So allowing us to come up with a solution that is diverse and addresses this issue from many different angles. So those diverse perspectives are very important. So you buying in your friends allows you to come up with a solution that is all-rounded, that allows the multiple ways of solving a problem that can then address issues that we're trying to advocate. Number 2, long-term impact on our health and that of future generations. We know that the world is made up of very many generations. We have our parents, we have our grandparents, we have ourselves, we have our younger siblings and our younger siblings, etc., etc. And in the future, you'll also have your kids and, it trickles down. So long-term impact on our health, us as a generation and that of future generations. Involving youth ensures that the policies that we drafted, that you learned about yesterday, are relevant to not only us who exist in this time and space, but those who will exist after us, because problems do not just disappear. Just because they have been solved now does not mean they might not emerge again later. So we know that everyone learns from history. We grow from our history. So being able to impact different issues right now would also inform future issues for other generations to come. Number 3, it allows engagement and empowerment. Now, engaging youth in policy action empowers them to become active participants in shaping their healthcare systems. I'm sure in your different communities, you've heard that we have the energy and the older ones have the knowledge. So when we engage the younger ones in this policy action that we're trying to implement, that we're trying to bring into the society and see action, they ensure that we have activity. They bring in the energy and the drive that youths are known for to be able to implement these policies that we're trying to bring in and then shape the healthcare systems and solve the problems we're trying to solve. So engagement and empowerment ensures that we're active participants in the policy work that we're drafting in order to shape it into action. And lastly, global collaboration. In IPSF, as I said earlier, we have everyone from everywhere. Every country that is a member of IPSF has an organization within that country, has leadership within that country that represents them within the IPSF global space. Now, when you bring all these minds together, it means we're dealing with a global perspective. You're dealing with people from different countries, and they bring in those perspectives from their countries. They bring in different versions of the same problem. For example, health inequality or access to medicine. It affects all of us in different ways in our different countries. And our approaches to such issues would be different, but it is solving the same core issue. When you bring in these different minds from different places, different communities, different countries, you result in global collaboration that gives your little problem a global perspective, global access, global ways of solving. It encourages global funding, and you result in solving of a problem by bringing in different partners from different places. Because yes, it affects you differently, but an issue that is happening in Kenya or in Zambia or in South Africa, for example, might also happen in Brazil. I mean, health is health everywhere. People are sick everywhere. So when you bring in the different perspectives and you try and solve a problem as our global community here, then you result in communities changing, not in just your country, but all other places. So when you involve yourself, when we as youth involve ourselves in policy action and advocacy, it fosters international collaboration and the sharing of knowledge by all of us in our different communities. I hope that is clear. This does not exhaust, of course, the entire scale of why we should engage. And the good thing about presentations is it gives you an idea, and from that idea, you're able to build more and more as you explore within the space. So I tried to introduce a few concepts here and there so that you're able to understand what advocacy is and how it is important to you and to me, okay? So we will move on to policy advocacy within IPSF. Now, the audience of our advocacy efforts, our policy efforts can be divided into 3 broad categories. The first is the IPSF external partner. The beauty of IPSF, another beauty, I know I'm praising IPSF so much, but it is because it is very important to me, is it has a very pretty website. I don't know how many of you have visited that website. By a show of hands, how many of you have visited the website? IPSF.org. It is right down. In one way or the other, between yesterday and today, or any other webinar you attended, have you glimpsed, by a show of hands or by emojis or by reactions, have any of you glimpsed the IPSF website? Hazel, a hand's being raised.
Seen any yet?
Oh, that is so sad. Why haven't you visited the website? The IPSF website is a very, very, very important tool if you want to get information about the organization you are representing. So be sure to visit it at least once or twice after this and throughout this workshop, because it will give you insights, more insights than I probably would. about advocacy within IPSF. The statements are there, you can go read them. Toolkits are there, you can go study them, etc., etc. But it is very important to see what is happening within the organization you represent, just so that you have the information and you can make conscious decisions. So diving back into our slide, the audience, we have external audience. These are the partners of IPSF. Partners include the WHO, as you can see their logo right there. We have FIP, that is the Federation of Pharmacists globally, which you will join when you graduated from school and a pharmacist. The UN SDGs, we have the World Health Students Alliance, we have the Fight the Fakes organization, we have the International Committee of Red Cross, we have the International Federation of Medical Students Associations, we have so many partners within IPSF. The audience of the advocacy efforts we have as an organization is one, those partners. Our stakeholders and as an organization are also privy to the activities we do within our organization. And the beauty of having partners is when they understand our advocacy efforts, they too can collaborate with us and give us a wider audience in the places they are able to get to that we can't, so that they are able to know that this is the stand we have as IPSF in this specific subject, and this is what we believe in, and this is why, and this is how you can help us make this idea a reality. So those are our external partners. You can see their logos, you can see who they are and what they do when you visit the website. So I've given you a first assignment for the day. Visit the website. I am sure David will check. Number 2, our internal audience. That is you and me, IPSF members, global, regional, local. From your organization, association, locally in your country, to the African Regional Office, to the global IPSF community. That is our internal audience. As a global community, we can have ideas that we want to make our members aware of, want our members to advocate for, want policies drawn as an organization on this and this topic, because the global space in terms of healthcare changes every day. New issues emerge, new solutions emerge, and our position as an organization is very important in those things. Therefore, every year you will see something interesting like global policy statements or World Health Assembly statements. And these are our way of buying in, our way of showing our stand policy-wise on issues that affect our global community. Members of IPSF go to the World Health Assembly. That sounds very big, I know, right? I mean, you get to meet the chair of the World Health Assembly, you get to meet all these delegates from all these countries, you get to meet the Secretary General, you get to get nice pictures for LinkedIn. That is a very important point. But it just shows you how important of a community IPSF is and how much you can do within the organization in terms of policy and advocacy to be able to access all these other partners in one way or the other. Could be our regional symposia, could be the global symposia, could be any forum, but they would be there, they would be attending, and you would be the one presenting or state. I'm sure you can imagine that. Sounds very nice. Anyway, you as members can participate in the drafting of these statements. You can, as contact persons, I am sure they're about to get to you. Michelle is going to badger you very, very steadfastly about writing the policy statements, the regional publications. Policy statements are a way for our regional offices, our global offices to show what we stand for in different topics. As you heard in my biography of sorts that was very short, obesity, non-communicable diseases were what we were drafting policies on in the year I was a regional secretary. That means every leader from every country within the African Regional Office had to write a position paper. This means they had to go do their research and write how diabetes or how obesity or how hypertension, high blood pressure affects their country, their statistics, their solutions, their statistics on problems, and then they present that to us. Then as the regional working group, we collect all those opinions from all those countries, and we come up with a regional office publication that shows our stand as the African Regional Office on non-communicable diseases, on obesity. It means all of you are very important in the drafting of the policies and the publications of the organization on different topics. How do we conduct policy and advocacy? I've alluded to it a little bit in the previous slide, but you can see the first box there says the preparation of regional policy statements. And I have tried to explain what that means. It means it is a, grouping. It is getting opinions of the different member countries within the African Regional Office, putting them all together in one document, showing what Zambia thinks on non-communicable diseases, what South Africa thinks, what Kenya thinks, what, Zimbabwe thinks, what every one of us, Tanzania thinks, what Rwanda thinks, how is it affecting them in their country? Putting all that together to come up with an African position on non-communicable diseases, an African position on obesity and how it is affecting us as a continent. It involves research, it involves writing pretty English, it involves looking at statistics, it involves you understanding how this topic affects you individually and locally, and coming up with solutions in your local spaces that can then influence our continental view of things. After the preparation of those statements, we publish a regional policy paper. It is a policy paper that shows this is our stand, this is how this issue is affecting us. These are the statistics on how many people are affected. This is the different solutions our different countries have come up with to try and combat or slow the progress of this particular issue. And this is the gaps we face as a community, as a continent, as this and this country. And this is what we think IPSF can do to bridge that gap. After that, we develop a policy advocacy toolkit. I mentioned that we move from policy, which is the theory. This is our idea. We're trying to beef it up a little bit so that we're able to understand the scope of the problem. That is the policy. That is the paper that shows us, okay, this is the issue we're facing. This is our idea on how we can solve this issue. Okay, it is on paper. How can we make that action? How can we implement it in our spaces? Because we have identified the problem. We have thought up solutions, but these solutions are not on the ground. These solutions are stuck on the paper. So how can we move it from the paper onto the people? The advocacy toolkit shows you that these are the ways that you can bring this policy to life. You can have a webinar educating people. You can have a competition trying to make our healthcare workers, our healthcare students think broadly on how we can make this an even better solution. You can have a symposia where you invite professors, teachers, doctors, experts in this field, and they can teach more about what they are doing, what they are currently investigating on how we can solve this issue. The toolkit gives you different ideas that can then be implemented, whether globally, regionally, or locally, in our little way of making this policy an action. So it can tell you, okay, maybe you can have a competition locally in your local organization, our local association, to make our pharmacy students understand the scope of diabetes. After that, you can then conduct regional projects on the policy topic. So you will see an Afro-Olympics that is geared towards this subject. You might see that you have a regional competition. You might have, regional webinars, a series that looks at the beginning to the end of this issue. And then you can also implement the same thing in your local associations so that the pharmacy students and the community at large in your local organization and your local country can be able to see that. So it can even be something as simple as a social media series of engagements, or a video, something just to show that this is an issue, we're trying to shed light on it, and this is how we can solve it as a people. That is the last point, engaging our member organizations in advocacy. Advocacy isn't a big word that is just for IPSF AfRO and global IPSF. It is your personal initiative, your personal stand on an issue that you believe affects your community and you think you have the solution to solve. Okay? We can move on to a few case examples of what IPSF globally and AfRO in itself are doing in terms of advocacy and policy. So this gives some of them, and I'll read out a few others. But again, go to the website. You will see these policy statements. You will see these toolkits. You will see different avenues IPSF has tried to shed light on the different policy topics we have been addressing for the past couple of years. Okay. So the first is rare diseases. This was done in collaboration with FIP. We have done a few antimicrobial resistance policy and advocacy. There's a toolkit. There is a collaboration paper in conjunction with the International Veterinary Students Association and that of medical students. A very good read. And there's one for strengthening regulatory frameworks within the region. I think this was done last year in conjunction with AMATA. Others include the World Health Assembly statements that I talked about earlier, where we as stakeholders and partners with the World Health Organization draft our position on different topics that are identified by the WHO to be talked about within this meeting. And then members of IPSF go to this meeting and they present our position on the same to be able to shape the global perspective on the different issues. Then we have a pharmacy education advocacy toolkit that looks at pharmacy education issues and how we can solve those. There's the IPSF declaration on the pharmacy roles in combating AMR, dispelling myths and increasing awareness. We have pharmacists as immunizers in Canada, vaccine hesitancy advocacy toolkit, statements on non-communicable diseases, primary healthcare, non-state actors, and lastly, the one I talked about, the call to action, combating the persistent global issue of AMR in collaboration with the Veterinary and Medical Student Associations International. All these are very many papers. They sound very intense, but they just show how simple ideas, simple issues that you think affect your local country can be impactful on a regional and on a global scale. Bring these ideas forward. Let us as a region think of ways we can draft policy statements, we can do research on these subjects, and we can show that we as students care about our communities at large, okay? Now, I've talked a lot about all these other things, but the main point of this day as we go towards the end of our presentation, how can we be involved? How can you and me in our little spheres of influence be involved in advocacy? One, I've talked about it a lot. Bring new ideas. We have different perspectives, we have different experiences, different thought processes. You have an idea that I may not have, that is impactful not only to you, but to me too, in my own country. Bring them forward. Let us see how we can bring those ideas to life. Contribute to the discussions. Contribute to the drafting of these policy statements on these position papers. Talk to your local contact persons, talk to the regional working group, talk to your subcommittee members, and see how you too can be involved in the drafting of policy and position papers in our regional office. Share the local perspective. If we want to not only come up with statistics to show that this is a problem, but also good solutions that are practical and relevant to you too, you have to be there. You have to bring your perspective forward. You have to help us understand what is happening in your country that may not necessarily happen in mine. If you're not involved, how will you know what is happening in your country? I don't live there, you do. I don't understand your culture and your communities, but you do. So if you are on the table, you're helping us discuss, you're bringing us research, statistics, ideas, innovative ideas that your health system, your health counterparts and stakeholders within your country are taking part in that may not be happening in my country, then we can come up with robust solutions that can push our continent forward in terms of healthcare. Okay? You can advocate locally, nationally, and globally. One voice is not enough. When we come together as a people, we're able to push agendas forward. We're able to bring ideas to life. We're able to impact our communities, our societies, our continent, and the world at large. You and your little voice can make such a big impact. Do not shy away from advocating. Attend meetings, represent the students. If you attend meetings, you're able to get information. When you get information, you're able to digest it and come up with your own unique way of not only making other people understand, but bringing in new ideas, bringing in buy-in. If you don't attend meetings, you know what's going on. If you don't know what's going on, how will you tell your friends what is going on? How will you represent students and those in your sphere of influence in these spaces and allow their voices to be heard, because they might not be able to get the access that you have, okay? Organize workshops, sessions, and simulations. If you're a leader in your local association, why not organize workshops on these policies? I mean, it might not be the regional policy, but you can have policy workshops, you can have policy statements as an association in your country to show what pharmacy students within South Africa, pharmacy students within Uganda think on this subject that might be affecting you, but students have not spoken up on it. So how will we know that it is an issue that trickles down all the way to the students? They too feel it. They are part of the community. If you don't organize workshops, if you don't organize sessions, if you don't organize simulations, how will other students know that they too can speak out on issues that affect them and their communities at large? Approach local authorities, because the funding, the buy-in, they have to be involved and they need to understand healthcare issues. You are a healthcare worker, you're a healthcare student, you understand what is happening. You can break it down from healthcare jargon to the little things that they can understand. You can explain to them why it affects them too. And when you do that, they are also able to collaborate, and you're able to bring this advocacy to fruition and come up with solutions that are able to eradicate these issues. Youth town halls, discuss with other youths in different organizations and communities, the education spaces, technology spaces, agricultural spaces. There are issues that affect all of you. Why not involve them too? Social media. Everyone has a social media page. I mean, we're in the age and the generation where our phones are our best friends. When you are showing your position on an issue in your social media, my followers are not your followers. You might even be an influencer and I am not. You might be popular, I am not. When you talk about issues, sexual reproductive health care, access to medicines, you talk about asthma, you talk about diabetes, you talk about issues, someone somewhere within your following list will be able to get information, will be able to ask questions and gain answers, will be able to understand about this issue and be able to also talk to their friends and their people about it. It is something that trickles down from you to other people. If you don't use your social media handles, how will they know that this is an issue? How will they know that they, as the community, can participate? They think diseases are for us to solve. But what about the lifestyle adjustments and modifications that they can also take part in and help their family members having this non-communicable disease, having this obesity, get better and not have a morbidity or mortality case? They have a relationship with these people. They can be part of the healthcare management process for patients because you allowed them to understand these diseases better. Simulations and debates. This is part of the advocacy that you can do within your local organization. Campaigns, public engagements, publications, raising awareness, having medical camps on these issues, etc., etc. But these activities are part of advocacy. Advocacy isn't a big term. It is literally the small efforts you make, the small steps you make to push it from an idea in your brain, an issue, to a solution, okay? And finally, what does effective advocacy of policy work look like? Effective advocacy looks like this 4 points. How do you know you have effective advocacy within your organization, or how do you know you're an effective advocate for an idea or an issue that you have identified? Number one, you're able to collaborate with key stakeholders. You're able to approach them, you're able to make them understand why it's important, and they're able to buy into the idea and help push it into a solution. This involves collaborating with government agencies, healthcare organizations, community groups to ensure the effective implementations of policies. Policies involve data, involve statistics, involve health jargon, involve big words, big terms, mechanisms of actions, mechanisms of disease pathophysiology. Not everyone can understand that. When you break it down to something simple that someone can understand, to make them also understand why this is a problem for them too, and you get them as stakeholders, you get them to collaborate with you, then you have effectively implemented your idea or your policy work. Next, monitoring, evaluation, and review of activities. No process is without monitoring and evaluation. It cannot work in the first time, or the first way of solving a problem might not necessarily be the best one. If you don't monitor the progress, if you don't evaluate whether the goals of your policy work or your advocacy intervention is going, the progress, you will not know whether it is working or not. Looking back at how you've moved from an idea all the way to an action is important in knowing whether this is working, or you need to change, or you need to introduce new ways, or you need to approach it differently. Now, when you review, when you monitor, you establish these mechanisms that can ensure that the impact of your policy intervention or your health outcomes to your patients are felt. Monitoring and evaluation of any process doesn't necessarily have to be advocacy. It is important in knowing whether it is being impactful or not, if your goals or objectives are being met or not. Next, getting feedback from stakeholders and members. When you organize a debate, you organize a campaign, you organize a webinar, you organize a conference, a symposium, getting feedback is important. You might think it's going well, but the participants are the ones who are actually taking part in whatever it is you have organized. You just organize from the background, but they are the ones who actualize your goals and your objectives. Talking to them and getting their feedback will ensure that your next advocacy plan, your next advocacy plot, your next advocacy intervention goes better, because we grow and learn from each other. We're not perfect in our own strength, in our own ideas, our own thoughts. Having this community of people that grows with you is very important, and getting feedback, positive, negative, is very important in ensuring that we grow in our advocacy work. So creating those loops to gather input from these stakeholders who buy into your idea, or these members who are participating in your idea, allows you to make the necessary adjustments for the next time, so that you're able to improve constantly and your advocacy work is able to reach more people. And finally, a sustainable plan for continuous action. Solutions are not immediate. Some of these problems are very big problems that affect a wide range of people. A lifestyle modification for obesity that cannot be actualized by, I don't know, in 3 months or 4 months. Having a continuous plan, one that is effective for long periods of time, ensures that your intervention, your advocacy intervention is relevant and remains sustainable, because these issues are always going to be there. Some of them are not issues that you can solve in 1-2 months, 1-2 years. They involve constant work of a long period of time. Having a sustainable plan ensures you don't burn out, ensures that your impact is constantly felt, ensures that your stakeholders are able to see that this is a plan that is going forward. We're seeing progress. We are solving this issue slowly by slowly, and soon we will have reached the place we wanted to get when we start. So sustainability ensures that you have funding, you have capacity, you fostered collaborations and friendships, your community understands what is happening, because the sustainability involves all these people and none of them feel exploited or used. So having sustainable plans ensures that it is continuous for a long period of time and doesn't stop in 1-2 months because maybe funding is exhausted or stakeholders no longer believe in your advocacy intervention. So these are some of the ways to know that you have effective advocacy within policy. In conclusion, any advocacy intervention, any advocacy activity involves everyone. It involves you, it involves me. Effective advocacy, outside of all these 4 major points, at the core of advocacy, your buy-in and my buy-in is very important. Understanding why this affects you as a person, affects you as a healthcare professional, affects your family members, affects your friends, affects your patients, very important. Because when you believe in an idea, that is the only time you're able to push it forward. You're able to implement it. You're able to wholeheartedly tell people about it, find new ways of coming up with solutions, find new ways of talking about it, spreading the word to other people. Be well informed. We're in an era where it is very necessary, as we're in a sector that is very diverse and very, it changes a lot. Knowing the issues that affect our healthcare systems, always having this thirst, this curiosity for knowledge, always thinking widely of how you can come up with new solutions, innovative ideas on solving such issues is very important in your growth, very important in your education, and very important for your community at large, because we are here for our patients. We are here for those who represent in our communities. I hope this has given you a glimpse into what advocacy is, and I am sure I'm going to see a lot of advocates in this room. Thank you very much.
For a profound presentation. That was indeed a practical session, empowering us on how to advocate, even within our day-to-day living and extending it to the pharmacy profession sector. So that was very informative. It was also engaging and fun. You have a way of engaging us, and that was a wonderful presentation from you. So now we move on to the question session. During the course of the session, we had written that if you had any questions, you could have written them in the chat box. But I think by raising your hand, maybe we can pick 3 or 4 people who can ask questions, and then Fam Tiffany can respond. She's still within us. So if I have anyone who has got a question, kindly raise up your hand. I'll take note of that and I'll give you the floor. Any question or even any comment? I've seen Vincent has responded that that was a very wonderful presentation and well appreciated. So is there any question from the floor? Okay, I think silence is golden. I'm glad that we managed to take in 1 or 2, and I do hope that you remember to finish our assignment, which is to go to that website and check it out. Is on that one, yes. And also, now I think, okay, before I hand over to David, to get in touch with Tiffany and for materials regarding this session, I know that we should kindly check in our emails. I think we'll get full details for that. To those who want to engage more with her, I think her contact details will be shared with us. Okay, before we go on, Vincent, okay, mine is not a question, but I'd like like to add that I have an advocacy project I'm actually working on in my country. We would be glad to get in touch with Doctor. So Farm Tiffany will share her contact details, and I highly hope that they'll be part of the package that we receive, the recordings and the materials, and I'm sure that we can get in touch with her. I hope that's fine also with her.
Yeah, it's okay. It's okay. I don't mind.
Okay, thank you very much. So now I can hand over to David to thank our presenter for a wonderful presentation and wrap up with a vote of thanks. So over to you, David.
Okay, thank you very much, Hazel. Thank you for both Steve, as I like to call you. Yes, so thanks to all the attendants to this workshop, to this session. So you had the opportunity to have this workshop with Tiffany Obai, alias Boss Chief. I hope that you will have you have the opportunity to take note of what will be necessary for you to do your position paper. So in case you need any additional information, any additional thing, don't hesitate at all to she forwarded her contacts in the chat box. So you can contact her. You can also contact the RWG members. You can also have a discussion with the other contact person or SEOs to see how far they are going with their position paper, how far they are going with or how they are proceeding to write their documents. So it's all about communication. You don't think that you cannot do it. So if there is anything, don't hesitate to join us. So something else I want to say is that Tiffany has been very busy. I can confirm, Dr. Tiff. So her being present in this session means a lot to us at IPSF AfRO. So thank you very much, Tiffany, for being here again. And thanks as well to our great moderator. It's my first time participating in a meeting where she's a moderator. She has been doing a very good job as well. And yes, on behalf of our chairperson, Michelle Mayuba, which is in travel actually, which is traveling actually, so she is not available. So yes, so on her behalf, thank you all for being here for this session, and I hope that we gain a lot, and after all this, not only for IPSF, but also for our community and for ourselves as well. Over to you. Thank you.
Okay, thank you, David, for a warm vote of thanks, and I hope